Among the many soldiers in our immune system, CD4 cells are the key commanders. These cells are a type of white blood cell that directs the immune response. They instruct other immune cells to attack and destroy harmful invaders. Think of CD4 cells as the generals in our body's defense army. They strategize and coordinate the fight against infections. When HIV attacks, it specifically targets these vital CD4 cells. HIV is a cunning enemy. It invades and destroys CD4 cells, weakening the immune system's ability to function. As HIV multiplies, the number of CD4 cells decreases, leaving the body vulnerable. Without enough CD4 cells, the immune system can't fight off infections effectively. This makes the body susceptible to opportunistic infections, which are illnesses that wouldn't usually affect a healthy person. Section 5. The onset of AIDS. When immunity crumbles. When HIV significantly damages the immune system, a person is diagnosed with AIDS. This diagnosis is a critical turning point in the life of someone living with HIV. The immune system, which is supposed to protect the body from infections and diseases, becomes severely compromised. This leaves the individual vulnerable to a host of opportunistic infections and certain types of cancers that the body would normally be able to fend off. This means their CD4 cell count has dropped below a critical level, leaving them highly susceptible to serious infections and illnesses. CD4 cells, also known as T helper cells, play a crucial role in the immune response by signaling other cells in the immune system to perform their functions. When the count of these cells falls below 200 cells per cubic millimeter of blood, the immune system is no longer able to effectively coordinate a defense against infections. AIDS doesn't develop overnight. It's the final stage of HIV infection, and it can take years to progress to this point, especially with treatment. Antiretroviral therapy, ART, can significantly slow the progression of HIV, allowing individuals to live longer, healthier lives. However, the journey to this stage is often fraught with challenges, including the stigma associated with the disease, the side effects of medication, and the psychological burden of living with a chronic illness.